them on a water pill. That's going to tell you right away. You know what you need to work on? Your urinary system. It's retaining water, and it shouldn't be retaining water, but they're going to give you a diuretic, which forces your body to release so much water. And that definitely should be a temporary thing. Temporary. You should be coming off, because there's a whole slew of things I could tell you right now that you could do to help rebuild the urinary system. But I'm not going to do that, because I want to make sure that you do this reasonably, and that you do monitor your blood pressure and do kind of work with your doctor. And feel free to call me so that we can see what the source of your blood pressure is. Now, we just ruled out the water pills, the water retention with the diuretics. Next, we get to the other two: stress or dilated or clogged arteries. By dilated, I mean sometimes the arteries are constricted, I should say, and there's inflammation in there, and we have a problem with that. So that's why they put the cuff on you, because they want to see how well does your blood flow under constricted conditions. Is your blood flowing well when we tighten the arteries? If you have bad flow anyway and they tighten it, it's going to really be bad. So that's their way of monitoring. So if that's the case, then I see a lot of people going to the health food store getting garlic. But imagine if your blood pressure was due to your kidneys and you really need a water pill, but you're going to the doctor talking about, I want garlic because garlic cures high blood pressure. I don't use the word cure, because your body's designed to heal itself. So I don't have to look at garlic as a miracle cure. I don't have to look at hawthorn as a miracle cure. I don't have to look at yarrow as a miracle cure. Sure, I use a lot of them, sometimes by themselves, sometimes in combination. But I don't have to call them cures. You know why? Because your body is the designer. It is designed to heal itself. God designed these bodies to heal themselves. So really, your body will take whatever it needs, the things that you give it to heal itself. So with the high blood pressure, that article that I just read, or that piece from the book, talks about some unpleasant side effects that could really be crucial. And this is one of them. This is off of an article, Sunday Tribune. It says, kidney failure takes deadly toll on blacks in Chicago. Well, that's like a microcosm of what's going on in America. I can translate that as saying that kidney problems are bad in America, but kidney failure is taking a deadly toll on blacks, particularly in Chicago. And there are reasons for that, and what we need to do is get to the root of the problem. Now, this is another article I got out of a magazine, popular magazine called Conscious Choice. This is years old, but it was written by a nutritionist, and it's called Nutrient Stealing Drugs. This is a fascinating article. I love this article. I Xerox it and try to give it to as many people as I can. In the article, Rebecca Ephraim says, there's no doubt in the U.S. healthcare system is built on a foundation of pharmaceutical drug use. That's not negative or positive, it's just stating a fact. 4 out of every 5 patients who visit a doctor leave with a prescription. It's projected that during the year 2001, that's back around time when I got this, there will have been 3 billion prescriptions written, which, if you do the math, comes out to more than 10 prescriptions for every man, woman, and child in America. Now, of course, not everyone takes prescribed pharmaceuticals, so this means that many individuals are taking a number of drugs at once, a situation known as polypharmacy. Often people in nursing homes or assisted care facilities take between 8 and 15 medications a day. In doing what drugs are supposed to do, that is, affecting change in the body by altering its normal metabolism, pharmaceuticals can cause untold numbers of other reactions to occur as well. We know them as side effects. However, one very profound side effect that appears to be a well-kept secret is that more often than not, a particular drug will deplete. And when they say a particular, they're talking about all of them. Aspirin, birth control, over-the-counter drugs and prescription drugs, they all deplete the body, each and every one, bar none. They all pull nutrients that we really can't afford if we have a health issue out of the body. It says right here that a particular drug may deplete the body of valuable nutrients, vitamins, minerals, etc., that in turn can cause even bigger health problems. Dr. Ross Pelton, a PhD, he's one of the foremost experts in drug-induced nutrient depletions. As a pharmacist and a certified clinical nutritionist, Dr. Pelton has co-authored 2 books on the subject, one for health professionals and the other one for consumers. Pelton is a staunch advocate of nutritional supplementation regardless of whether one is taking drugs. And I've said that all the time. We all need supplements. Now here's a stat from the Surgeon General. And this is an old report. It's like 1988. It says Surgeon General Report 1988. Most illnesses occur as a result of nutritional deficiencies. And it's true, nutritional deficiencies. And people are probably thinking, I'm not nutritionally deficient. No, we eat a lot of food, but the food doesn't deliver. Only about 5 to 10% of the population takes a daily supplement. Drugs deplete B vitamins, calcium, magnesium, antioxidants. Antioxidants are like vitamin C, vitamin E, zinc, selenium. These are antioxidants, and CoQ10. So if you're taking medications, you're being zapped twice. One, from the drugs. Number 2, because we're not getting what we need from our food. And it's really, really something, because he says over-the-counter drugs are culprits of nutrient depletion as well as prescription drugs. Laxative medication, antacid medication, anti-ulcer medication, things like aspirin and Tylenol, and some of the anti-inflammatory drugs, all of these pull vital nutrients out of the body. Now, my thinking is this. I'm not on a campaign against medication. I know that they're necessary. But what I'm saying is if your physicians go to, college, and they go to, their residency, and they don't learn anything about vitamins and minerals, they're steadily giving out prescriptions, and you're steadily going to the drugstore and getting over-the-counter things, or you're taking birth control, or you're taking an aspirin a day to prevent, that's a whole nother story, an aspirin a day to prevent heart disease. But if you're doing these things, they don't have the knowledge to tell you, hey, look, I've just given you a prescription for prednisone. Guess what? Prednisone is going to pull so much calcium out of your body that after so much amount of time, it varies from person to person, we're going to be putting you on something like Ascal or Boniva or whatever. It's something to strengthen your bones, because the prednisone is going to take so much calcium out of your body. They don't know to tell you that. Not only does it take calcium out, but it takes B complex. Those are your nerve vitamins, your brain vitamins, your stress vitamins. They also help your body to produce healthier blood. So in doing this, I've seen several people come in who have taken prednisone for a period of time. They want to come off the prednisone, but guess what? They've also been put on an antidepressant because of all of the calcium and the B complex that the prednisone took out of the body, that they didn't know to supplement so that they wouldn't go into overload and be diagnosed as being depressed or have anxiety. So we're talking about root causes. So if you are on a high blood pressure medication, you should give us a call, because depending upon how long you've been on it, you've got some systems that you need to work on, be it your circulatory system, your nervous system, or your urinary system. Your cardiovascular is your circulatory system. So you may need to work on those. Now, this is an article I used to give out all the time. I kind of got in trouble because this is actually taken from the Bible. This is some biblical information. I'm going to read it to you. Not the scriptures per se, but just the information in this article that is talking about foods we should avoid. It gives you a list of pork, any fish that doesn't have shells or fins, and it starts off by saying that fish that have fins and scales, or the ones that don't have fins and scales, there are the cleanup crew.